name's Bryony Jones. I'm an obstetrician and a specialist in fetal and maternal medicine. My NHS job is based at Queen Charlotte's Hospital. I work with Miss Nouri, who's over here. He also is a specialist in fetal and maternal medicine based at Queen Charlotte's. And I would like to talk to you today about a little bit about normal antenatal care, about what you can expect from standard care, and then the potential about some of the benefits that you might achieve from having private maternity care. So it's a journey. The birth of a child is one of the most wonderful experiences that can happen to a woman and her family. And that experience affects that woman and her family for the rest of their lives. And I speak from personal experience, being a mother of 2 children myself. I very much know that that's the case. And I think it's a time when that experience shapes the lives of that woman and the couple and the family for the rest of their lives. And hence it's incredibly important. I feel I have a very privileged position as an obstetrician and being part of that process and helping those pregnancies and births be the best they possibly can. And I feel from a medical perspective, it's the ultimate in health promotion and delivering a healthy generation for the next future. So what I'd like to talk about a little bit is about, for many of you may be pregnant, many of you may be thinking about pregnancy, and to think about what standard sort of antenatal care involves, and then potentially about what potentially the benefits of private care can hold. And maternity care within the NHS is based really around the NICE guidance. And NICE is the government organisation and body that helps commissioners for healthcare, helps GPs, obstetricians, midwives, all the disparate parts of the multidisciplinary team that deliver care for women in order to plan good, safe maternity care for the population. And then you've got to remember there are 700,000 women who are giving birth in England and Wales each year. And this strives to standardise the care that's available that all women should receive very similar care. Now that care will need to be tailored based around that woman's individual needs, but essentially it lays out clear sort of guidance about the safe antenatal care and birth for women. So standard maternity care within the UK, again, is a schedule of appointments. So often a woman determines that she's pregnant, her pregnancy test is positive. She then will go to the GP who will refer her to hospital for antenatal care. Or many hospitals now have online self-referral booking systems that women can refer themselves onto. And then they will see the midwives at around 8 to 10 weeks of the pregnancy for a booking visit where the midwife will ask them a series of questions, ascertain their general health, ascertain if there are any complications for the pregnancy, offer screening tests. These are maybe blood tests to check for infections, check for general health within the woman, identify any risks for the pregnancy. Women will be offered screening tests and scans to correctly date the pregnancy, and there'll be some seminars later on today talking about the potential how ultrasound and scans can be offered in pregnancy. And then again, we'll make a plan for the pregnancy. Now, this sort of schedule of care will vary a little bit as to whether you're a first-time mother or a second-time mother, or whether you've had any complications in a previous pregnancy, or if you have any health concerns. But generally, women have anything from 6 to sort of 9 appointments throughout the pregnancy, and these are usually based with the midwife. So most women who are deemed to have a low-risk pregnancy will not see necessarily an obstetrician throughout the whole of their pregnancy. This will be midwifery-led care, usually shared with their GP. There'll be a series of other screening looking for any potential issues from offering screening for any chromosomal or genetic abnormalities to scans assessing to assess for any structural problems at around 20 weeks. So essentially there will be antenatal care planned at the beginning of pregnancy with a series of appointments that are preset with 2 scans in the pregnancy to correctly date the pregnancy, and another scan at 20 weeks to be able to assess any structural problems. So pictorially, we would probably have some blood tests. You see, when they see the midwives, they'll be taking some risk stratification, looking and assessing any potential problems in the pregnancy. We'll be assessing antenatal care and antenatal consultations, or essentially screening for growth problems with the baby, so measuring the size of the pregnant abdomen by using a tape measure, which usually corresponds with about 2 centimetres of how many weeks pregnant a woman is. We screen also for a condition called preeclampsia. That's why the midwives check for blood pressure and protein in the urine. And that is a condition that about 1 in 10 first-time mothers will have some issue with blood pressure during the pregnancy. And so the blood pressure and urine will be checked at each appointment. During those antenatal appointments, there will be some discussion about the place of birth, where and the type of birth that women want. So within the UK, probably about 2% of women opt for home birth. There are some standalone midwifery birth centres within the UK, and there are birth centres that are midwifery, one which are attached to hospitals, and then there is a hospital-delivered centred care. And so those are really options for women. There was a report published earlier on this year from written by a whole maternity group, but chaired by Baroness Julia Cumberledge, which looked at, reflected the safe nature of antenatal and birth care within the UK, but pointing out they did a survey of many women's experiences about birth within the UK. And although wanting to put women at the centre of their care, this can be a challenge within the NHS, which is, again, a lot of the care is based around population-based care and delivering care to a group of population of women, rather than individualising for that one woman. Some of the surveys that they said were that women felt that care was implemented at them rather than actually being given a choice. In many parts of the country, hospitals are at 100% capacity, and community services may be not at 100% capacity, but some women aren't able to access those services because of the administrative boundaries that exist within the NHS. Many women felt that they didn't necessarily have complete control over what they wanted and what sort of care and the place that they wanted to deliver. And so there is work to do, and there is work that we should all outline some recommendations for the NHS to take forward. So what can private care do? Well, many women may not have the option of NHS care. So some women who come from overseas, they may not have the option of having private care. Many women are used to a more medicalised approach from different countries that they come from, where it is standard to have an obstetrician look after you throughout the pregnancy. But many women choose private care because they want a different experience. They want a sense of control. They want a sense of being given a choice about what they want, where they want to deliver, who is looking after them. And we'll cover some of these later on. I think the biggest reason why people choose private care is to develop a relationship with that person who's going to be looking after you. The person who you may see at the first scan that tells you that you're pregnant, shows that the pregnancy is within the womb, may well be the person who is actually looking after you and delivering your baby at the end. And that's a really special moment as an obstetrician, to be able to be part of that woman's journey right from the start to the very, very end. And it is sort of metaphorically and sometimes physically hand-holding the couple through their pregnancy in this really special time for them. And knowing that if there are any problems throughout the pregnancy, you know that person point of contact. You know that person who's going to be looking after you. You know that they know you, and developing that really important relationship. It's about putting women right in the middle of the care. They're in the centre. They have the choice. They can choose what they want, when they want, how they want. And it empowers them and makes this the most positive experience for them. Some women come to see me before they're even planning to get pregnant, the ultimate in planning of pregnancy. And planning is important for all pregnancies, to try and deliver safe care. As an obstetrician, my job is to plan for all eventualities. We talk about having a magic wand for the birth preference of a woman's choice, but ultimately sometimes some things happen where we're not expecting things to happen. And so it's being able to plan safely for birth regarding for any eventuality that might occur. In addition, people arrive pregnant who've come on various different journeys to get to that point. Some women have had to have assisted conception in order to achieve a pregnancy, and so they need additional help or additional support to help them through, especially through those initial few weeks and months of the pregnancy. So I think planning, again, is very important, and the woman is right in the middle of that care. I think it's also about choice. When you choose the person who's going to be looking after your baby, you want them to have the skills, the experience, the knowledge that you need for your pregnancy and your birth. So in addition, for example, you want someone who's going to choose that you want to have a water birth, for example, where you want to choose someone who's going to have those experience, who can tell you, well, I do conduct water births regularly on a regular basis. What are the chances of being able to access all those facilities at that time? If you choose a caesarean birth, for example, you want to know that that person has got the experience and ability to do a caesarean section safely and rapidly as necessary. You've also got the choice of having someone who's available for you 24 hours a day, 7 days a week in case of any emergencies. So most private midwives and obstetricians, there will be a contact number that will be available for you should you have any problems or concerns. And it's that one point of contact, which is really very important, so that you know that if there's any worries or concerns, that reassurance that you can contact them if you have any issues or any concerns. I guess it gives additional optional tests. Medicine does change. It changes fairly quickly. This morning you'll be hearing from Professor Nicolaides, who about some tests in early pregnancy. The screening for genetic and chromosomal abnormalities has really, really changed in the last few years. The NHS is not able to offer this absolutely to all populations of women at the moment. And so certainly this has become mainstream within the private sector within London, being able to offer really good screening tests without any risk to the pregnancy, screening for conditions such as Down syndrome. In private sector, it's very common that women have more ultrasound scans to assess the growth. There's an emotional aspect of this, of ultrasound scanning for bonding with the baby, but probably more importantly, we can assess the growth of the baby, how the pregnancy is progressing. And in my practice, women will generally have at least 3 growth scans throughout the sort of 3rd trimester in order to assess the growth of the baby as accurately as possible. The additional, there's screening for, some women opt for screening for other infections, such as Group B streptococcus, which is not necessarily available through the NHS. And another factor of it that does not to be dismissed lightly is the convenience, the appointments, the accessibility of care. Many women are working full-time, they may be juggling other children at home, they need to have that ability to be able to book an appointment when it's convenient for them. Within the private sector, we often offer appointments either on alternate Saturday mornings or in the evenings, and this enables couples to come to the appointments together. To enable them to make this as holistic as possible. Appointment times are generous, they're usually not a 10-minute slot, it's usually a 45-minute consultation. We have the luxury of being able to offer women as much time as they need for those appointments. The flexibility, if you can't make one appointment one day, then it's a point of contact, having a secretary. You're not being put through a switchboard, trying to get through to change an appointment. There's usually most private midwives and consultants will have a one-point secretary that you can call to arrange an appointment either by email, text, or telephone. And in today's era of sort of being able to, sometimes the appointments can even be made electronically in many times, which is all improves the access and takes away one of the stresses of modern day living. And many people choose private healthcare because of the facilities and experience that are on offer. And certainly the ability to have partners staying with them after the birth, having your own private room, having the facilities that make this a more luxurious and special experience is really important. We know that the birth place, the environment that woman gives birth in is really important. We know that it has psychological impact on women at the time of birth. Women need to feel comfortable, relaxed, safe in order to have a good and easy birth. And the facilities and experience within the private sector are able to be more generous than those available in standard maternity care. The default position for any baby after birth is that it stays with the mother. However, should you want, with women who are exhausted or tired, then often private facilities will have a nursery that enable the midwives to care for the baby, just to allow mums to have a few hours rest and sleep. And you know that you're reassured that your baby's well looked after. And so we move on to the types of private care that may be available. Increasingly within the UK, there's private midwifery care available, which is suitable for women who are likely to have low risk and less complex pregnancies. And the midwives are able to look after women in different birth settings, either hospital, birth centre or home birth. Midwives are experts in normal care, able to offer holistic continuity of care. In addition, they offer support for the mother and the baby after birth. It is usually less expensive than obstetric care, and it really relies on that one-to-one care for normal birth. They are practitioners of normal vaginal birth, so they're not able to help if there will need additional support should there be any complications that arise during the pregnancy or at the time of birth. And there are different setups within London and other hospitals, but in essence, most private midwifery that would revert to sort of NHS care in the event of there being an emergency or a concern. Although at Imperial, we can offer a joint private midwifery and consultant setting, which is increasingly attractive. Private obstetrician care is the commonest type of private maternity care. This offers sort of complete birth care, can advise and offer care on both low-risk births, but also in more complex births, and in case any complications or anything happens during the pregnancy. There are different packages of care. Some women choose to book right at the beginning of the pregnancy and have care right from the very beginning, from 8 to 12 weeks to throughout the pregnancy. There are some women who start having their care within the NHS and choose to move to private care later in the pregnancy for the birth. And there are some women who choose to sort of top up antenatal care only, having antenatal consultations with a consultant and maybe extra scans through the pregnancy, but then may choose to have their birth within the NHS. And how do you choose? Well, I think most of my patients arrive with me from personal recommendation. I think you've got to feel that you're able to have a relationship with that person because you're going to be seeing a lot of them. So most of my patients will see me for at least 14 appointments during the pregnancy, and at those times we get to know each other extremely well during that time. And so you've got to be someone that you feel that you can work well with, that you have a mutual trust with, and I think you have to meet that person in order to feel that they're going to be able to do what you want them to do. Ultimately, it is your choice. It really involves a very dependent upon that consultation. Part of that is also on convenience. If you have a very busy work day on a Tuesday and the appointments only work on a Tuesday, that's not going to work for you. You've got to choose the hospital that you may want to deliver the baby at, and half of women may choose their obstetrician first and then choose the hospital second. Many women choose the hospital first and the obstetrician second. So it does vary amongst different women and couples. And I guess when you're choosing the hospital, you've got to choose what facilities you feel that you might need. So, for example, if you really want a pool birth, then you've got to make sure that there's going to be a pool available for you. If you decide that you have more complex or multiple pregnancy, for example, you may want the facilities of having a neonatal unit. If the pregnancy does have any problems, you may want to have the facilities to have a special care baby unit that's going to be able to look after the baby after birth. So all of those factors go into that in making a decision about who you choose and where you choose for the birth. And there are going to be some talks about this further tomorrow. So from Imperial, we would like to say that we offer a very personalised service. We have across 2 sites within London and West London, both at the Lindo wing, which is St Mary's Hospital, and at Queen Charlotte's Hospital. As I said, we work, all the obstetricians work both within the NHS and within the private sector. And that gives essentially the backup should there be a complication. The majority of pregnancies are safe without any problems at all. But what is difficult is that at the beginning of the pregnancy, we can't always necessarily determine whether complications are going to happen. And so you've got that reassurance that should anything happen, then we've got all the backup and all the facilities that our great NHS can offer. So thank you all very much for your time and listening today. I will be available, as with many of my colleagues outside, to answer any questions that you have now or after the seminar. So please do come and find us. Thank you.
Would anyone like to ask Bryony a question?
I do have have some questions, but it's more on a sort of personal basis.
Of course, no problem.
No problem.
I'm happy. I'm really happy to ask now, Bryony, but it's more a case that I am a complex pregnancy.
Yes.
I think I spoke to you last week about it.
Mm-hmm.
Sorry,
So,
we're just going to put a mic to you if that's okay. Sorry. Thank
Sorry.
you. Sorry.
Bryony, as you know, well, top line no, I am a complex pregnancy. So I'm sort of stuck between the NHS and private at the moment, not knowing where I should go. And, as you say, you can't predict what is going to happen, but I had quite a traumatic experience in my last pregnancy that I had at the NHS, which is why I'm now fearful of the resources at the NHS. Although they are very experienced, it's more about the level of resource that I could get.
My feeling, my opinion, is that the NHS excels in complexity. I think that when there is a real problem or a real concern during the pregnancy, this is what the NHS deals very well with. And I'm so sorry that you had a difficult experience last time. But I think that, yes, some people choose who have more complex pregnancies to go into the private care. The issue with that is you need to choose your facilities that you're going to have to enable to care for that complexity. And I think if you do choose private care in that sort of situation, you want to probably choose a hospital that's got all the backup of the NHS in case there are any concerns regarding that.
So you don't think there'll be an issue with if I was to have the child at the Lindo wing, baby at the Lindo wing, and then if there was a complexity, they'd move me to the NHS or something?
They would. So most private hospitals don't have, for example, a critical care or high dependency care that's available just purely for private. So, for example, there are different setups in different hospitals. At Queen Charlotte's, we do have a maternity high dependency unit that would be able to be accessed by private patients should they need. It's based on a first come, as in clinical need. If you were a sick private patient, you would receive that care as you would from an NHS patient. Within the Lindo wing, they don't have the high dependency unit care there, but you would be transferred to the NHS side, which would have those facilities. So you have the backup should that be needed.
Which is why I would rather stay at a private stroke NHS hospital, because there is the option of both if necessary.
I'm going to present a slightly biased opinion because this is the system that I work in. That's why I have to put a balanced viewpoint. There are other different caregiving options within the private sector that perhaps offer different models of care, which all have their benefits and their pros and cons. But I feel that this works very well. I feel that you're working with colleagues that you normally would work with on your day-to-day NHS jobs. So if there are any complications, you can easily access them. It's all about the team that you work with, and if you're used to working with that team, you can deliver good care. Of course.
Keep it today with you. My name's Barbara, and I run with my colleague here, Anne-Marie. We do hypnobirthing classes. Is that any part of the package that you have for your mums that come to the hospital? Do they do any kind of...
Absolutely. Jenny Smith, who is our midwife, who's just here now, and for the women who choose to have a shared midwife and obstetrician package, or for those ones who just want to have obstetrician-led package, we have access to hypnobirthing classes for women. Absolutely.
Because I think with yourself, I think that what we get women who have had a negative experience.
Yes.
And I think the hypnobirthing, what it allows you to do is to be prepared for whatever type of birth that you have. And I think what you were saying about the environment and building a relationship is so important to do that, because then the trust is there. But actually learning techniques of where you can feel calm, and also empower the father just makes such a difference. So it may be something for you to consider with yourselves, is doing some type of hypnobirthing antenatal.
Is hypnobirthing not for natural birth?
No, not at all. I don't know whether you would like to explain more, because obviously this is about your
well,
service.
it's not just about I'm representing Imperial healthcare, but certainly, I mean, the hypnobirthing is about putting yourself, in those most simplistic terms, it's about putting yourself into a relaxed state to be able to cope with whatever is ahead of you. Now, people use different techniques in order to achieve this, whether it's visualization, whether it's different relaxation exercises, but that they find themselves are able to relax, and you'll be able to deal with pain better, be able to psychologically cope. Some people have a concern about more complex delivery. On one side, people have had sometimes bad experiences from vaginal birth, and they're very concerned about having a further vaginal birth in the future. We often use relaxation exercises together with some hypnotherapy techniques to be able to put you into a relaxed state in order to be able to cope with any situation or pain, and particular pain.
So would it help with early delivery as well?
Yes, I mean, one thing that it does is it actually helps you throughout your pregnancy, because what it does is really what you was asking was about, well, what are your choices? One of the things I think a lot of hypnobirthers and any practitioners within pregnancy are passionate about is that when you understand your choices, you feel more in control immediately, because then you're being given the full knowledge. Certainly within hypnotherapy, it's nothing really like that you would have seen on TV. It's about positive language. A lot of it is about, so that belief that you have, coming from a genuine reason, going to a hypnobirther or a hypnobirthing class would allow you over time, by listening to relaxation techniques and the breathing techniques that you would learn, it changes your mindset. It gives you a different belief system, so that when you go into your early labour, instead of having anxiety and fear, you feel calm, and then you produce that wonderful hormone oxytocin, which you need loads of. But also the partner feels more empowered, because they also learn every process of the labour, so that you are able to work as a team and they become an advocate for you. So again, what you were saying about the convenience of being able to have appointments when your partner can come, we find dads just want to be able to come. It's so important for them. And when we see certainly the births after, and we see quite a few, don't we, that have had perhaps a negative experience, by the end of it, and with then the care that they get, both with, and I think what you said about, we see a lot of where they start with private, but if there is a reason, they go with the NHS, and have been amazed with the support that they get. But it really is sort of having that emotional support and being knowledgeable of what the process is going to be, going to see the place where you're going to be, because then immediately you feel more comfortable. But it just keeps your relaxation levels really good when you're pregnant.
I mean, I actually had a friend who did it, and hypnobirthing, and she turned up at the hospital 9.5 centimetres dilated, and she's completely put. I just thought for medical reasons I couldn't do it.
No. It wouldn't mean that you would, by any means, I don't think any hypnobirther, I'm not a midwife, but I think it complements midwifery beautifully. So no, I think it's about you having complete care, so that you learn the skills that you need to be able to change your mindset, help with relaxation, empower you for when you go into that. But you also have a midwife giving you all the information and support there, so that you feel completely, both emotionally and knowledgeably and physically, you feel ready to go through that process.
It's another choice, really, isn't it?
Thank you.
We often do sort of birth rehearsal classes, for example. So in women who've had a more difficult experience beforehand, we actually do a tentative. They come to the hospital, we walk them up the stairs to where they'd first come in, we show them the room, you sort of get used to that, where they're going to put their things, all the things are going to be laid out. Those women are going to have a cesarean section, we take them sometimes into the operating theatre, have a look around, they meet the people who are going to be there, they know how many people, each role they're going to be doing within the operating theatre. So again, it's all about that sense of control. control that you're feeling. That's not necessary for everyone who's having a birth, but there are some women who really need that. And it's all about being responsive to the needs of the person that you're looking after. And we have the luxury of doing that within the private sector because we have more time. And that's the issue.
Another question. Thank you very much, and good luck.
Thanks.
It's not really a question, just a comment. I work with Miss Jones as well at Imperial Private Healthcare, and also Miss Norrie here as well. And we just very much want to advocate the holistic approach, thinking about people mentally as well as physically, not just for people who've had previous birth trauma, but also to protect them against birth trauma. Because often, what we often find together, and we work quite closely together, is that people, if they're unsure about what birth is, in its entirety, the environment, mentally, physically, those are the people that are more likely to have unmet expectations and then perceive that birth journey as really traumatic or not quite right. So hypnobirthing is another method of preparing yourself psychologically for birth. That's all.
What's the best way to choose an obstetrician? Do you choose the hospital first and then the obstetrician?
I think it's half and half, I have to say. So, and it's the same sort of in London. I worked in Sydney for many years in Australia, and I think half women choose the obstetrician first, and then they choose the hospital based on where that obstetrician practices, or they choose the hospital first and then find an obstetrician that works at that hospital. So it can be both, and I don't think there's a right or wrong. I think it depends. Again, it's what's right for you. What is the key thing that you're concerned about or worried about or want to mitigate against?
Okay. Is there anywhere online where you can see like a list of obstetricians in the UK?
There is, so there's within the, so different hospitals will have their own obstetricians that are available. So, for example, Imperial Private Healthcare, if you type in, you'll see the list of obstetricians that practice. I'm here with contact details for them. Dr. Foster will also give a list of different obstetricians that around. I'm not sure about a whole list, a national list of obstetricians, no. But different hospitals certainly list the different obstetricians and where they practice.
Thanks very much.
Do you have any questions about where you're looking at the moment? Maybe ask Bryony or do you have any Queen Charlotte? Yeah. Did you want to ask another question? Yeah. Just wondering, if you've chosen private care for the birth,
Yep.
how does it work with mixing up having scans under the NHS, which I understand are only 2, but if you're wanting additional scans, like the Harmony test and...
So if those people who are choosing NHS care, you can choose NHS care and have top-up private care. So what that would involve is you could additionally book for additional scans or additional antenatal consultations. Then Queen Charlotte's, we have an option of you can pay for a private room after the birth, or sort of an amenity facilities. Your care is still under the NHS, but you are adding in different aspects from the private sector into your care. So sort of topping up sort of the NHS care, as it were. If you choose private care, then one of the sort of rules and regulations around private healthcare is you're booked for private healthcare. So therefore, all scans, all investigations, all blood tests with the institution all come under private care.
So that means you won't be then entitled to the NHS scans?
No, exactly.
Okay.
Yep.
And is it possible only to have private care for the birth and
Yes.
have NHS for the scans, or will that also sort of pull you into the everything counts under private?
So some women choose to have their NHS care up until, for example, late pregnancy, and then choose to opt from that point onwards for private care for the birth. We usually have sort of 2 or 3 appointments to enable to get to know, to start that relationship. The downside of that approach is that you sort of miss out on that relationship building that happens throughout some of the risk assessment from having full sort of package of antenatal care, but certainly enables you to have the option of having private care for the birth.
Okay. And sorry, just one more question. So if you do the scans with the NHS and have your birth privately, but then you're doing additional scans, like the private scans,
Yep.
is it some way of linking that up with your chosen obstetrician with your private?
So many obstetricians will do growth scans themselves, so that you could either choose to have that scan with that obstetrician during the pregnancy, so when they do look after you later in the pregnancy. It's important to know that obviously obstetricians will look after some women for the whole pregnancy to make sure that they're going to be available around the time of your birth. and that they've got the capacity to take on. So the majority of private obstetricians will offer full package of care, and that will be the majority of the care that they do, but they will have some availability for sort of late transfer of pregnancy care. I'm not sure I've answered your question, but sort of.
Right, thank you. Bryony, can I ask a question?
Of course.
And really kind of coming from your side as well. Can a couple choose to come to you, you know, maybe in week 30 or week 32 of their pregnancy, maybe the baby's breached and they've decided that they want to deliver privately or for any other reason? Is that possible?
Yes, I mean, of course. I mean, some people come just for a consultation. So they just come just to have that 45 minutes of having the time and discussion for another opinion, or maybe just for further explanation about what's been told to them within the NHS, or they may want to explore private care for delivery. Some women will have insurance, so medical insurance that will cover them for some aspects of the care. Medical insurance within the UK is not particularly comprehensive towards private obstetrics. Many of the international insurance companies are much more comprehensive, but occasionally some of the private health insurance will cover a cesarean section if it's needed for maternal reasons for the mother or having issues in the past. So it's worth exploring that. But no, certainly you can, again, it's based on availability, and but no, it certainly is possible.
And does anyone else have another question? Yep.
If you choose the full private package and you want to do further testing, for example, thrombophilia or further testing for recurrent miscarriage along the way, is that included in the package?
Well, it depends. If your GP has referred you to NHS services for those testing, then that can still be done through the NHS auspices, an umbrella, as it were. But if you are instigating that treatment through the NHS, through the privately, then that would need to be done privately.
Yes, purely privately. So because according to the NHS, you need at least 3 miscarriages. So if
I see what you mean. So in the investigations for recurrent miscarriage, absolutely. So we see women who want to have further investigations that would not be eligible for under NICE guidance under population, but women can opt for those investigations privately. I think it's always worthwhile just reflecting that it does have some of those investigations have implications about life insurance, future health. So it's not just a tick box test. It's always worth having that consultation, because there are some good reasons why NICE and the NHS doesn't offer those investigations as a first instance. But again, it's that conversation. It's been given a choice. It's been given that information for you to make your decision as if you would like the investigations or not.
So just to clarify, why wouldn't these investigations be done on a normal basis, according to NICE?
Because
I mean, why do women have to wait 3 miscarriages to actually have the
It seems very hard, and I sort of totally understand why people think it's just the fact the majority of those investigations will be normal. And in the cases when a woman has sadly had a miscarriage, usually that is a chance event for that particular pregnancy and has no implications, reassuringly, for the future or any other pregnancy. And so from both a personal perspective, from a cost perspective, from other issues, NICE doesn't warrant further investigations for that, because in the majority of cases, all those investigations will come back as being normal. And so the reason why they say, well, wait for 3 miscarriages, because once a woman has had 3 miscarriages, the chances of there being an underlying pathology actually is still low, but having lost 1 pregnancy rather than having recurrent pregnancy lost.
Okay, thank you.
Anyone else? Oh, sorry. Thanks, Julia.
This is one last question. What are your views on, let's just say someone did have to have an emergency labour, on recovery in private?
I think it's, one of the fascinating things that I have from having worked overseas, having worked within the NHS, having patients who come to me from all over the world and with bringing their different birth experiences that they've had, I've learned an awful lot about what else happens in other countries and in other sort of institutions. And we know that in years gone by, 10 years ago, certainly at the Lindo, women used to stay in for 7 days after they had a baby. And that enabled you to have the full support of having a midwife that was there to help you with breastfeeding, additional support. You had your meals prepared for you. I mean, there were so many potential benefits. Yes, the downside was that maybe separated from other family and other children, perhaps separated from partners during in that if they weren't able to stay with the mothers. But certainly culturally and society, we've moved on. Everything moves on at a much rapid pace. People stay in hospital far less amount of time than they used to, and that's based sometimes on women's preferences. Some women want to go home after spending sort of 24, 36 hours in the hospital after a caesarean section because they want to get back home to their family. And actually, there's no absolute medical reason why for most women, that they need to stay in hospital during that time. But there is, I think, a slight cost to that in the fact that it's hard to increase breastfeeding and support and numbers and increase our percentage of women who are still breastfeeding at 2 months and 3 months when they don't have that one-to-one support that absolutely was there in the hospital. That is offered in the community, so the midwives will often do a sterling job in the community supporting women breastfeeding, but it is no doubt that it's much easier when women are in hospital. So the ratios of midwives staffing are more generous within the private sector. You've got the facilities, in the fact that you're in your own room, you can sleep, you can rest, you have the option of the midwives taking the baby in order for you to enable to get some sleep. And that's no doubt that makes it an easier experience for a new mum, having been through it myself. I speak from experience. But, it's a challenging time for any new mum. So there isn't an easy option, but there's no doubt that having that experience definitely makes it easier.
Bryony, can I add to this lady's
Yes.
question, and we'll have to let you go then. I just kind of adding on from you is postnatally, how does private care cover you? So if you do go home, say day 3, and you're trying to recover your breastfeeding, etc., do you have more care down the private route, or does it end when you leave the hospital?
No, not at all. So even for standard private care, you still access the NHS resources, so the community midwives will still visit you at home and offer you all that community-based support. But you've also got the luxury of being able to call the ward, both at the Lindo wing and at Queen Charlotte's. There's a midwife on the ward 24 hours a day, 7 days a week, who's able to give simple advice regarding breastfeeding. Any concerns, women can come back in again, be given additional support. There are specific packages for postnatal midwifery care that are available, that if you want additional support for the midwives to come to your home and help. So all that expertise is available to you. So no, there's more support, definitely more support available.
Thank you, Bryony. And if anyone has... Do you have one more question?
Sorry, just a quick question. I don't know if it's true or not, but I've heard that some of the scanning equipment in NHS hospitals isn't as advanced as some of the scanning equipment in the private clinics. Is that true?
I don't think that is fair. I think there are clear guidance that is released from the screening committee, the National Screening Committee, that has clear standards for a minimum standard for all equipment within the NHS services. And I have to say that the majority of NHS services have excellent equipment, which is more than capable of providing the images and the image quality that you'd need. I mean, I think the differences are that in private, someone comes for me for a private growth scan, for example, I can spend that time trying to get the baby in a good position to try and optimise to get a picture of the baby, or the 3D or 4D picture of the baby. That's easy to do, and because I've got more time to do that. Whereas they may not have that amount of time to be able to do that on the NHS.
And if you're having the private care, say at Queen Charlotte's, is it the same doctors and the equipment and the staff that are also working in the NHS section, or is it a separate?
So all the staff are NHS trained. So you've got all that backup of having staff that are used to working within the NHS, but they're working within the private sector. So yes, all the staff will work within the NHS too.
Last question. If you're booked privately for just a normal vaginal birth and there's complications and you're needing a caesarean, will that then be treated as a private cost, or will that then move over to NHS cost?
So that will depend upon which package of care that you had opted for. So if the standard obstetrician-led care, your care would still remain private. So for most obstetricians, their fee is based whether this is a quick 2-hour birth, or whether this is a 36-hour marathon birth with sadly having a complication, needing an emergency cesarean section at the end, your obstetrician fee is exactly the same. You make that commitment to that couple when you're looking after that baby to look after them throughout, regardless of any, and it has to be that way, really, to deliver the best possible care. So that's the commitment from your obstetrician. For the hospital fee, they may have some differences because obviously the equipment, the resources that's needed for a cesarean section will be greater than that from having a straightforward vaginal birth. So the hospital fees will differ. There may well be, you may require an anaesthetist, for example, so there'll be a medical fee for the anaesthetist for the cesarean section, or should you choose an epidural, for example, during the birth. But the actual obstetrician fees will be the same. If you choose a midwifery, private midwifery option, then it depends a little bit on the packages that you choose. So for private, within Queen Charlotte's, Jenny Smith will talk to you about the packages, but if there was an emergency, your care would revert to the NHS through a midwifery package. If you opt for the joint package, then both Jenny and myself are there, or Ms. Joash or Nuri, who will be there throughout the birth in addition to the midwife. So therefore, it would be complementing each other. So you then opt for the private obstetrician would undertake the cesarean section if it was needed.
Thank you.
Pleasure.
Thank you all so much for your questions, because I know it's not very easy to ask around these issues. So thank you.
Thank you.
Thanks so much, Bryony, for your time today. Thank you.
Good luck, everyone. Thanks for that.